good morning or good evening, depending on where you're watching from. This is the second Google Hangout of the Citizen Engagement Massive Online Open Course. For those of you who are joining us that are learners of the course, you've now been through 4 weeks. So you started off with the theory of citizen engagement and its history, where you heard from Helene Granvoyer on one of the talks. And then we moved into policy, citizen engagement and policy making, citizen engagement and public service delivery, innovations in citizen engagement, and now in your final week, it's citizen engagement in practice. So basically we thought, in order to tie all of this together, we would do a Google Hangout on the effectiveness of citizen engagement and how it's monitored and evaluated. So with us today, we have 2 experts here in DC and 1 in Brazil. This is Helene Granvoyer. She is a senior social development specialist here at the World Bank. And we also have Yiro Acuna Alfaro, who is with UNDP Responsive and Accountable Institutions Policy Advisor. On the phone from Brazil, or rather by video from Brazil, we have Vera Sachin Coelho of the Brazilian Center of Analysis and Planning. So thank you all for joining us. Would you all like to introduce yourselves a little bit more than I did myself? Helene, I don't know if you want to give a brief introduction about maybe what sectors and policies you've been working in lately.
So welcome. My name is Hélène Grandbonnet. I'm a lead governance specialist at the World Bank. I work in the Africa region currently on some systemic country diagnosis. I've worked a lot on social accountability issues for several years. I was leading the community of practice within the World Bank on social accountability, but it was also open to external participants. The thing that I had presented for the book, as some of you have probably seen, was the findings of a book we published last year on understanding better the context for social accountability.
Okay, well, good morning. Thank you, Kate, for the invitation. First of all, as you mentioned, my name is Jairo Acuña. I'm the policy advisor at the Responsive and Accountable Institutions team, the Governance and Peace Building cluster at the United Nations Development Program in New York. So what we are trying to do is to advance that conversation, the two-side relationship of citizens and public officials to deliver better services, particularly focusing on post-conflict environments when it comes to restoring basic core government functionalities. And what we have found is that the engagement of citizens in getting back these services, it's key in the long-term sustainability of that process. Previously, I was in the UNDP Vietnam country office, where we engage in the largest social accountability tool in the country. We monitor on an annual basis public sector performance at the provincial level on an annual basis in all 63 provinces. So I think it would be interesting, also to reflect some of those lessons learned from that experience when it comes to engaging citizens, right? To not only participate in the monitoring, but also sit down with the policymakers and the public officials to shape service delivery and public policies.
Well, thank you. And Vera, can you hear us?
I'm listening.
Would you like to say a few words?
Good morning. I also want to thank you very much to participate in this debate and also for the opportunity to join this very vibrant and interesting group involved with the theme of citizen engagement. In São Paulo, I work at SEBRAP, as you told, and there I coordinate the citizenship, participation, and health group. And I also work at the University of the Federal University of ABC. And what I will present today is part of my work in comparative research on citizen engagement in public policies, and especially in health policy. So,
well then, perhaps we should start the discussion with you, Vera. So your experience has been largely focused on the role of citizen engagement in health policy. How have you seen citizen engagement promote a more equitable distribution of health services? And has this been a short-term or a long-term effort?
Okay, Kate, thanks for the very simple questions. As it will be discussed today, there are several methodological challenges related to the measurement of citizen engagement outcomes. And in this brief answer, I will propose a really tentative approach, which we developed once we tried to relate citizen engagement in Brazil and the process of health inequalities reduction that happened here in the last years. So I think this is an important theme. Inequalities in Brazil have been decreasing since the beginning of the 90s. And different economic and political explanations have been given to justify this achievement. And one of this approach really called attention to the idea that citizen engagement made a difference in the reduction of inequalities in Brazil. And the rationale goes as follows. Brazil really built a very important infrastructure for citizen participation in the last 25 years, and citizens became more involved in this policy process, in the decision-making related to public policies, and in the end of the day, we had policies that are more accountable to their needs. I think that this rationale is really okay, but the real story is that it's very difficult to measure the real contribution and to isolate the contribution of participatory institutions to inequality reduction. And in fact, I'm not going to do this here. I'm not going to isolate and measure, but I will try in the next minutes is to explore plausible connections between what we documented in the routine of the health councils, the local health councils in São Paulo, and the implementation of the Brazilian public healthcare system. I don't know how much you know about the council, so Kate, should I do a brief introduction on the context?
I mean, I think basically, yeah, that would be great. We're just trying to kind of, get a sense of, how progress is measured and linked back to citizen engagement.
Okay.
In general. So,
just to have an idea, this councils, we have today more than 5,000 of these local health councils in Brazil, at the national level, the state level, and the municipality. And they bring together citizens, public officials, and health providers. And the idea of these councils is that they really decide about policies and that they monitor their implementation. This enormous infrastructure for citizen participation in health policies was created together with the Brazilian public health system. They were enacted in 1988 by the Brazilian Constitution that restored democracy in the country. And this public health system guarantees that 70% of the population have access to free care, appointments, consultations, vaccination. So it's a universal health system that really guarantees access to all the population. And the question for us is, councils really made a difference. Can we relate this impressive participatory infrastructure to the expansion in the last 20 years of the Brazilian healthcare system? And this healthcare system came in parallel with the reduction of health inequalities in Brazil. So we have three important things: participation, implementation of the Brazilian public healthcare system, and reduction of health inequalities in Brazil. Can we link these three factors? Well, let's go back to the routines of the local health councils that we documented through several years. When we looked at these councils, the socioeconomic profile of these councils, we found that they really included a number of non-white people, of citizens that not even completed primary education, and a good balance between women and men. So from this point of view, marginalized citizens were really involved in the health councils. When we analyze the minute, the discussions that happen in these councils, we find that we're not just shopping lists. People are not just complaining and demanding. On the contrary, they really had discussions about health policies, programs, problems with service delivery, and also local problems as water supply, infrastructure, or security. And all these discussions helped public officials to become more aware of the problems faced by users of public services, and also about their ideas about how the system could be improved. And also very important was the monitoring activities. For example, councils discussed how to reduce patient absenteeism for consultations and suggested a number of solutions. And they also organized the monitoring of the building of hospitals and health units. And finally, they had a very active role in defending health as a universal right. It was a citizen right. And they did this in the local councils, in the state councils, in the national level, year after year. And it's very important, this defense of the system. So this dynamics helped to understand how thousands of councillors meeting monthly contributed to develop a more inclusive and citizen-centric decision-making process. So this dynamics happened together with the expansion in the last 20 years of the Brazilian public health care system, which in turn happened together with improvements of some health indicators, as for example, infant mortality and life expectancy, as well as what's more important for us. The indicators not only improved, but inequalities between and among regions, states, and municipalities reduced. So given this picture, I believe it's reasonable to bet on a plausible association between the democratization of the policy process, the permanent defense of the rights agenda, the continuous monitoring of the public health care system, and its expansion, vitality, and contribution to the reduction of health inequality in Brazil. So it's a tentative approach, as I said, and I would very much like to hear your reaction to this approach. Thank you.
Well, that's great, Vera. I think that leads us kind of into our next question with Eero, is that, you discussed there a lot of the role that citizens and these councils play in determining the health policies and how that's linked to actual health outcomes. But Eero, the UNDP has a Global Center for Public Service Excellence, which you talked a little bit about, and they have a new publication called Citizen Engagement and Public Service Delivery, the Critical Role of Public Officials. So in this paper, it suggests that reform-minded public officials can improve development results by using citizen engagement in a variety of ways. Would you want to talk a little bit about that? What kind of ways that this paper discusses how, as opposed to Vera, where you're talking about citizens and these local councils, how it can be pushed from the side of the government and public officials?
Yeah, thank you very much, Kate. I think that it's a very good segue from Vera earlier on, because one of the things that that we are identifying from our experience of supporting social accountability is that perhaps one of the triggers that makes it sustainable at the long term or successful at the long term is the two-side relationship, right? So it's not just the demand side, but also we need to match that demand side with the supply side, understood as the government or the public service agent in charge of delivering that particular public good in that sense. What this publication does is it basically tries to identify what are the pressures from the supply side, right? And it's defined as the public officials and the politicians that will have to respond to those demands from citizens. I talked earlier, Kate, about the bridge, right, between citizens and the states, right? But it goes beyond the bridge, right? It's trying to understand what is that disposition of the implementers. What are the motivation of the public officials to really engage when citizens are increasingly demanding higher quality and higher accessibility of services. What are their incentives? But also trying to understand what are the fears too, right? From the supply side, what drives public officials to accept, the participation and to engage in the participation, or what drives, the public officials to retrieve a little bit and go back to their terrain, saying, this is my domain, this is my procedure, this is my service. In terms of your question, what are these different ways in which what we call pro-reform public officials can engage with citizens? First of all, elicit information and ideas. It's an important source of information for the public sector to support public service improvement, but also to defend the public interest from capture and clientelism, that we keep talking about also in different ways. And most importantly, we believe is the importance to strengthen the legitimacy of the states in the eyes of the citizens and to bolster what we call responsive and accountable institutions in the public sector.
And so, in your experience, what have you seen some of the incentives be, just off the top of your head, that really, because in some contexts, closed context, or corrupt context, it can be hard to change the incentive structures from elite capture and clientelism to one where citizens really are fully engaged. What have you seen as some of the incentives to get public officials to be interested in citizen engagement?
Well, first of all, recognition.
Yeah.
Right. That that engagement you will be rewarded some way or another, right? For the public official, but also that the demands or the pressure for demands or the pressures for the reformers reduced for the engagement. Right, public officials just they want to engage and they want to see that their load, workload gets reduced and not increased with higher demands. But clearly, Kate, I think that there are three things happening in this when we talk about incentives. Right, it's not a one-off scenario. Right, there are iteration process that will have to happen, and I think that the example of Brazil earlier on talked about in the longer term the annual monitoring aspects. But the way that we are trying to phrase it is there will be confrontation, right? Because what you have is a clash of incentives from the citizens and also from the public officials. There will be a process of accommodation. Both sides will have to be accommodated, the citizens and the public officials. And again, there will be a trial and error process involved. I think that all social accountability exercises, that we have seen, and maybe this is, for you, Helen. It's, there are things that work and things that doesn't work. Most of them might not work, right? And then it's how do we learn from those? And then, when we come back to the next iteration cycle, we try to, to improve, that, type of mechanisms.
So really, you see this as, if we're talking about things happening as a process in the next iteration, is this a longer term process
I
in
think
order
it's
to build
absolutely-
sustainability of citizen engagement?
Absolutely, yeah. And this is something that, because of the increase in demand, we tend to focus on the short term, right? But, and then, when we talk about social accountability, most of the time it's focusing on a very short period of time, when there is a protest, when there is a demand, right? Because a particular public service has completely break down, right? But what we are learning is that we need to expand that scope a little bit, right? How do we identify the pre-breakdown of the service, so to speak, in the extreme case, right? And then, once the intervention of once the accountability, has been put into place, what will be, the response over time to make sure that, we don't have a relapse into the previous context.
Well, I think this leads really well into a question I have for Helene, which is, given this long-term and kind of difficult and complex area that is citizen engagement, how do you measure the impacts that have been attributed to citizen engagement? And in the World Bank publication, Opening the Black Box, you discuss the difficulty of measuring the impact of citizen engagement. And, we just want to know what are the methodological challenges of measuring citizen engagement outcomes, and how does the framework you developed in the book help with kind of overcoming some of these challenges?
So I think that what's very important to discuss at the beginning is, as you say, citizen engagement and social accountability have various objectives. And there are a lot of expectations about these processes. And some of them want to influence the states, reduce corruption, increase the responsiveness of state officials. Some of them will look at the interaction between state actors and society actors, and they look at improving the channels for interaction between citizens and state officials, or elements that are much deeper and less instrumental about trust or legitimacy of the state. And some of them are looking at outcomes that affect directly the well-being of citizens, improved provision of public goods, and also elements that are more institutional, meaning like stronger empowerment of citizens. So when you look at the range of outcomes, most citizen engagement or social accountability initiatives, we look for a mix of those, but they might have also priorities. In the book, we have a case study in the Khyber Pakhtunkhwa province in Pakistan, where after a conflict, the state of KP decided that their main objective in putting in place some citizen engagement channels in their state was to rebuild trust. So that leads me to the challenge of measuring. When you try to measure an improvement in outcome or in the provision of service, you're not gonna measure this the same way that you try to measure the perception of citizens toward their government and whether they trust it. So that's one of the challenge. So there are three main difficulties in trying to measure the outcome of citizen engagement. If you lay aside the fact that you need to be very clear at the beginning, what are you trying to achieve and to support, and trying to distinguish some of these outcomes. The three main difficulties is that first, some of the outcomes we are trying to measure are complex to measure. I mentioned trust. Second, there the issue of time and time length of the interventions, and Rero just mentioned that. We are talking about trial and errors, but we're also talking about some improvements and outcomes that will take time. You don't change the perception of trust in one-shot intervention. So this means that when you put in place system to measure the impact of the intervention of the initiatives, you need to come back to them and you need to get a system in place that allows you to measure in the medium to long term. And I'll take one example to that. There is an interesting paper on Indonesia where there was a lot of measurements of how parent-teacher committees in schools didn't have much of an impact on the way schools were managed in that particular context. So if you stop at that intervention, you try to make sure that parents would communicate to teachers and the principals. There were issues about their selection, how much they would meet, what they did in the school. But the evaluation was saying, well, frankly, this thing didn't really work. But then a few years later, a different team of researchers was actually exploring who were the parents who took to the streets and organized protests to advocate for free education. And it turned out that a lot of the citizens who were doing that had been members of the PTAs. So it was interesting to see that to some extent the PTA initiative had been deemed unsuccessful, but you could also see that this unsuccessful activity, because the schools didn't have better learning outcomes, had created some social capital or some sort of awareness of their rights or their capacity to demand from government. These parents were more likely to then organize to ask for something. So I thought that was an interesting example. The third point I want to make on the difficulty to measure citizen engagement processes is that we have, at least in the academic literature, there's still a bias for quantitative methodologies. And the shortcoming of such methodologies for long-term citizen engagement processes is that, first of all, they often have a limited time horizon, which is, as I mentioned, an issue. Second, they need to, they cannot work with trial and error. If you want to do a randomized control trial, you're gonna have a very fixed set of variables. You want to try to change as little as possible within the intervention. So you don't allow the intervention to learn from the process. And third, a lot of this quantitative impact evaluation of social accountability are measuring a change in information. And as we discussed along this MOOC, information is crucial for social accountability to occur, but it's not the only ingredient or the only component of social accountability. So if you only measure an additional information without paying attention on whether there is a parallel process of civic mobilization or interface, for example, then you're measuring a small, narrow part of what we call citizen engagement. And in some cases, this led to evaluation showing no impact. And in circumstances where, frankly, maybe you would not really expect an impact. And I take one more example of a study that was made in Tanzania, where parents were given information by a random person knocking at their door about their child's outcome at school. And then the parents didn't act upon this information, but perhaps it would have been more effective to see whether first the person providing this information already had some trust in the community, and second, whether there were any channels the parents knew about in order to communicate their fear or disappointment to the school system, whether they had organized group they could join to do that, and on the other side, whether the school system was organized to answer this demand. So to summarize that, I think that long-term horizon, mixed methods, but also a very clear understanding at the beginning of what is it you are trying to achieve and what's your primary objective for the intervention are key elements to make sure that the monitoring and evaluation will be useful for what you're trying to achieve.
Great. Well, thank you. Now we're going to move into the question and answer period, taking questions from some of the MOOC learners that you all submitted over the past 3 or 4 days. So we appreciate your participation in giving those questions. We won't be able to get to all of them, but we're going to try to get to a majority of them, and particularly ones that are around certain themes. So building on what Helene just spoke about, Vera, are you there in Brazil? Hi. So this question is for you. This comes from Beatrice Rodriguez. She says she works at the Ministry of Health, and she has a big question about representativeness. And this kind of speaks to what Helene was talking about. They have a participatory process for doing health services with representative structures from patients, doctors, universities, and the industry. But they don't really have anything where the citizens participate in these types of processes. So, if you're talking about a quantitative measurement, there would be a lot of engagement here. But the quality is something that is of interest. And she just wants to know, how can they do consensus with delegates from those structures, and on the other hand, also have a different mechanism for citizen engagement with actual citizens?
Well, sorry, but I don't know exactly what is the mechanism she is discussing. So in this mechanism, citizens are not on the table, or they are on the table, but the quality of the proposals don't feed the discussion.
So she was just saying that basically that their processes of engagement include a number of stakeholder groups.
Mm-hmm.
But they want to cast a wider net to include not just patients, not just doctors, but citizens in general, to help influence some of their health policies. So without too many other specifics of this particular engagement, how have you seen, such as in the councils, reaching out beyond the typical group of people?
Well, there is lots of very good discussion about this, in the world. If you should go for random selection, if you should go for citizens that are underrepresented in the policy process, if you should choose citizens or organizations. And what we found in these councils is really a kind of mix, because here we worked with local councils. When you go to municipal councils or state councils, only organizations are allowed to register and to be voted to be councillors. But at the local level, you can go just as a citizen. The question is, how do you really make this process known for citizens? This is one of the big challenges we have in Brazil. When we speak about 5,000 councils, it's a lot. 100,000 councillors is a lot. But when you go to the ordinary citizen and you ask, do you know about this process? They don't know. No? So I think that this is something that has to do with education, with publicity, and I don't see investment in this area. Really, how do you disseminate the fact that we have all this infrastructure, that citizens can go to this infrastructure, can use them, and probably this is something that has to begin in the school. Citizens from the very beginning has to learn that they have the right to participate, and then to learn that there is all this infrastructure in the country and that they can go and participate. I think that to work more on the dissemination of these councils and this mechanism that the health ministry use, and to make citizens know about them, is something very important that has to be done. I don't know if Jairo know a lot about experience really looking to call citizens to the table and disseminating this information to them.
That's great. Yeah, and that brings us to some questions. We received a number of questions related to power dynamics. So we probably received about 3 or 4 from Alicia Bloomberg, Van Brabant, and Ms. Menon. So thank you very much for submitting these questions. Kind of along the lines of what Vera was talking about, how can we ensure, given different power dynamics, how that feedback from citizens can actually be used by public officials and influence policy? So, you know, given the different power dynamics of the bureaucrats that receive this information, all the way up to the elected officials and beyond, how does this feed into the system as a whole?
Yeah. Well, you know, I think that, Kate, you know, this is, you know, goes to the heart of the matter in terms of what determines what is a successful intervention or engagement, right, on a particular service provision. But then also, you know, I don't want to engage in a tautological debate, but you know, what is successful for one actor might not be successful for the other actor, right? Or what is deemed successful in one intervention might not be successful for the other intervention. What we have seen is what this publication that the Global Center for Public Service Excellence just finished, which is this confrontation aspect that happens, you know, between the citizens as the recipients or the users of those services and the public officials as the providers of that particular process. Where is that confrontation? And so what drives that confrontation? Confrontation is not necessarily a negative connotation, right? You know, confrontation, you also can have positive outcome, you know, over the intervention. But again, trying to understand what motivates the provider of that particular service that, you know, we're trying to fix, right? What motivates the school principals in, to engage with the parents in the school? What motivates the healthcare providers, you know, to make sure that, you know, the citizens also come to these councils and, you know, and give their inputs through information, you know, the different ways, you know, that we had identified. And, you know, it's that the disposition of the implementers that we have to understand. In stable context, it might be easier to do that, right? It might be easier, you know, to address that. But in post-conflict situations, I'm thinking South Sudan, for instance, today, right, where there's a big debate in terms of, you know, who's going to be the actual provider of the service, right? Or that process of defining, you know, who is the public official, will drive, you know, the level of success or not of the actual, you know, engagement in the service.
Excellent. Well, this kind of leads us to another question that Jean-Christophe Charlard submitted, one of our MOOC learners, and he wanted to know, and Helene, this might be a good question for you, building off of that, is in non-democratic or in closed and fragile and conflict affected situations, how can you trigger or ensure responses from government in these types of situations? And how can you sustain citizen engagement over the long term in a situation that is inherently fluid?
I mean, I would distinguish probably between the non-democratic context and fragile ones, though sometimes it's obviously you can have a country that's close, but I think that what we found when looking at the experience of citizen engagement in contexts where either freedom of speech or freedom of association or political contestation is not accepted, is that very often social accountability initiatives are either organized by the state on its own terms, think, for instance, example in East Asia, China, or in Ethiopia, there are some the states that are called often in the literature as developmental states. Part of their legitimacy is to provide services, and they do organize some channels to allow citizens to give some feedback on what is provided to them, because they want to have some sort of checks and balance in the system, which is otherwise lacking such checks and balance. In such context, it is sometimes in the interest of the central government to ensure that lower levels are delivering what they are supposed to do, and the citizens are brought in to provide feedback on that. The limitations of that is that there are some areas that can be off limits. No? Could be issues around some of the most important trends for a given country, or some areas where some citizens would have wanted more of a say, that this is not considered an area where the state would allow this opening. And in such cases, the areas that are off limit are sometimes the terrain for mobilization for protestation or violent protestations. In fragile states, it's actually difficult to have some generic findings on fragile states. But there are some studies that show that in a fragile environment where the state is either not controlling its entire territory, or has really lost legitimacy, or have very, very diminished capacity to deliver anything. Some accounts say, well, citizen engagement might not be the better start, because if a public official has no means, budget, capacity, or even not a very clear knowledge of what they should be doing, what are the citizens going to ask for? But at the same time, you see in such states, sometimes the government officials are the ones who want to engage in such relationship to rebuild this trust, as I mentioned earlier. But you also have often, in some cases, groups that have really coalesced because of the absence of the state for years, and there's a self-help group, community group that have organized themselves to act collectively, and those are able to have, if supported, they can come up and start a relationship with state officials. In other cases, what has been documented is that, especially in case of violent conflict, when trust has been severely undermined by open violence, then there might be an issue as well on how to rebuild this capacity for collective action for citizens. So again, a pretty mixed answer, but what's interesting is to see that we have various examples in such different contexts, and some of the donor-funded interventions occur in every single context, and they have various outcomes. But what is really interesting also is look at what has been done organically by organizations that were created without any external impetus, and that are managing either on their own or with like-minded public officials to create some relationship and increase accountability.
Thank you, Helene. So I think we're going to finish up with a question to all three of you. We'll start with the two people here in DC and then go to you, Vera. So basically, just to kind of sum up the conversation, maybe just 1 or 2 minutes each, if you could just give an idea of some of the indicators most commonly being used by your project teams, Helene at the World Bank, Cairo at the UNDP, and Vera in your studies in Brazil and with the councils that you work with in Brazil. If you could just give kind of a overview of some of the citizen engagement indicators that you use, I think that would be really helpful for some of our learners to understand the practicalities of monitoring and evaluation. So Helene, would you want to start off with what we do at the World Bank?
So I think that there are a couple of websites you can look at as well to see some more specifics. And one of them I want to mention is the Social Accountability e-guide, which is also accessible externally, SA e-guide, that have a full page on monitoring and evaluation indicators. Some teams, so the indicators would really depend on what type of intervention are you doing. But teams often distinguish between elements around information, whether, for instance, were the media used or the channel used to provide the information, how many people did receive it, how was it translated, was it some information that was given, the various channels, etc. There are a lot of indicators on participation, and on participation it's going to be not just numbers, but as Vera was mentioning, what was important in the Health Council was the sheer number, but also the representation of vulnerable groups. So you often want to have disaggregated numbers on that. And what are the who are the individuals participating? There are also a lot of indicators that pertain to the degree of satisfaction that user of social accountability indicators or participants attribute to this intervention, and where they're more satisfied with the service, where they're more satisfied with the where they're aware or able to use the interface, etc. The typical social accountability tools also come a set of specific indicators attributed to them. I want to give the example of the grievance redress mechanisms, where people look not only at the sheer number of complaints, but the percentage that were redressed, but also the percentage of redress that was redressed to the satisfaction of the person filing the complaint.
Just very quickly, because there's a very big question actually, to close the session. But I think that there are two elements in terms of when we talk about indicator. Helen already mentioned some of them. The organic nature of the indicator or the accountability mechanism of the engagement, right? It's key. Like the endogenous aspects of the process, is critical, right? We tend to think in boxes as development partners, and these are the menu of indicators that we have, and all too often what we have seen is that when we go to the field, it's just not applicable to that particular context. So the endogenous elements, of the indicator, it's key. But second, I think that we are in a stage in which we are coming to terms that perception is not the answer for the indicators, and we need to move on to more experiential questions, right? And so the best indicator when it comes to this engagement is, when you go and ask the citizen, what did you actually do? How did you engage? Not how do you think the engagement is going, right? So for instance, if you are sick, or one of your relatives has to go to the clinic, right? Tell me, how was the intervention? How was the treatment? Was your relative sick, cured or not? What was the interaction in the health facility or not? Rather than how do you think the services are being provided? And in this project that I mentioned earlier, in Vietnam, that we have been engaging, we're moving in that direction, trying to zoom in to actual experiences, provide that information, and then sit down with the implementers and discuss, okay, here we have 60,000 experiences that we have collected. Here is a summary of all that information. How can then we improve that experience for the next iteration? And that's when the public officials then start thinking about the indicators is just a starting point to have the triangulation with more a quantitative narrative type of assessment in terms of how do we increase that engagement that make it sustainable over the long term.
Great. And Vera, are you there? And
Okay, let me close this round with telling you a little bit about a comparative research we did in the city of São Paulo, where we tried to do something very similar to what I presented in the beginning, where we tried to relate the dynamics of local health councils with the access to health services. You know? And then what we looked at the dynamics, we looked at inclusion, sociodemographic, political, and associative inclusion, at the dynamics of the councils, how they were deliberative or confrontative, how they had or not have facilitators, and so on, and how if users were satisfied or not with the dynamics. We looked at the connections between the councils and the executive branch, the legislative branch, the health system. So which councils were more connected, and also at the decisions in one hand. And in the other hand, we looked at access, the number of basic consultations that we had in this, we worked in 6 areas, you know? So 6 different peripheral areas of the city. So we looked at access to basic consultations, access to hospitalizations, the number of new units that had been built in these areas, and we tried to see if there was a plausible relation between areas that were more dynamic in their participatory dynamics and the areas that were better in terms of gaining more access to health services. We could find some relations, but I can say that it's really complicated to make these associations, and I completely agree with Helen and Jairo that we need to go on slicing down the elephant and trying bits and trying to resolve a little bit of the equation at one time and then a little bit more, because it's very complicated to isolate the effects of participation in something so big as health policy, for example. So that's it.
Joining us today. This is the last week of the course, and so we really hope that this Google Hangout, along with all the videos in the 5th week, Citizen Engagement and Practice, has given you a little bit better understanding of the practicalities of implementing citizen engagement and also monitoring and evaluating its effectiveness. So your citizen engagement project, if you are completing one, is due tomorrow. That would be Wednesday, March 2nd. The specifics on the time are included in the course calendar, and the course wraps up on Sunday. So thank you very much for joining us today, and thank you so very much for your participation in the Citizen Engagement MOOC course. I know we all enjoyed hearing from you all and your participation throughout the 5 weeks of the course. Thank you so much.
Thank you. Bye.